Bismillahirrahmanirrahim. Hi everyone. So this is second video about suggestion how to present in the journal club, and this time we're going to talk about the methods. I believe the discussing the methods is really important. Is probably the most important part of the journal club, because one of the important goals of journal club is really to familiarize ourselves with the terms and words that you usually use, and why they use it, and what's a basic background of that method or that term. So please, I suggest that you pay a little bit more attention to the method. I know sometimes the terms might be a little bit not very clear or too technical, but it's really important that at least we have some basic knowledge about it. So take some time when you going over the method and try to present the information that you learned in a simple way to the audience. So the study setting really includes basic stuff. For example, you want to present to your audience the structure of the study. For example, this study was international, double-blind, randomized, placebo-controlled trial, and it would be nice if you can just ask a quick question. For example, why do you think randomization is really important in trials, or what's the difference between double-blinded or open-label trial, for example? And also, who did the study? Who are the researchers? Where was it? Where was the study done? In which setting? In which country? When was the study conducted, and the duration of the study? Who funded the study, or who were the sponsors of the study, and discuss whether that make any difference in the study or not. And then give them really kind of the basic structure of the study. For example, this one is the researcher randomly assigned in a 1-to-1 ratio 731 patients with heart failure with an EF of at least 50% and a BMI of at least 30 to receive either tirzepatide or placebo for at least 52 weeks. And then you present to them how they dosed the medications. So I think these elements are really important to include, when you're talking about the study setting and the study structure. Next, discuss the inclusion criteria. Which patient population should be included and why? Ask your audience, and discuss whether these inclusion criteria can actually increase the internal validity of the study, and whether the audience think that this inclusion criteria is actually appropriate to the research question. So, for example, in this study, let's say if the researchers said that those who are included, they had an echo report saying that the ejection fraction is more than 50% more within the last 3 years. Well, maybe 3 years is a little bit too long, right? Maybe the ejection fraction changed for these patients. Maybe some of these patients, they actually have an ejection fraction less than 50% in an echo done, I don't know, 6 months or 12 months ago. So maybe instead of having the inclusion criteria being an echo report in the last three years, to have it in the last 6 months or 12 years, to make sure that you really include patients who are truly have heart failure with preserved ejection fraction, to make sure that you're really testing what you say you're testing in your study. So discuss that with the audience. And then, of course, naturally after that comes the discussion about the exclusion criteria, right? So as the audience, which patient you would like to exclude and why. Most of the time, people will talk about the issue of safety of the new medications and whether patients who might be harmed by the medication should be excluded. That's probably an important part of the exclusion criteria, right? And then talk about the external validity and generalizability. Do you think excluding certain patients make the result of the study not really relevant to your patient population that you're seeing on your daily practice or not? That would be a good discussion. Next, discuss the primary outcome and the secondary outcome mentioned in the journal. Ask the audience whether they think that the primary outcome is appropriate, whether they have any other suggestions, maybe for a better primary outcome from their perspective. and also the same for the secondary outcomes. So for example, in the journal that we talked about, we discussed the composite primary outcome, and the pros and cons of having a composite outcome, because I think it was important and relevant in this particular study. So discussion about primary and secondary outcomes is very important. Next would be probably the statistical analysis, and I know many of the internal medicine resident might not be too familiar with many of these terms, unless the resident has some background of epidemiology or statistics, or they just have some interest in that. I believe it's one area that's a little bit vague to many of us. But I think it's still very important that we try to learn the basic terms and statistical methods, to try to figure out whether the researchers use the appropriate method or not. Usually this area is when, if you have a statistician with you during the journal club presentation, this would be really useful. They can give you really nice and helpful insight about it. But knowing the basic stuff, I think, is still very important. So don't shy away from it. Try to learn the basics. Try to see if you can present this statistical method in a simple way to the audience. That would be great. They will really like it. For example, in this paper we talked about the intention to treat versus the per protocol principle in analyzing the result, and what's the difference between the two. And then we talked quickly about the Cox regression model in a very simple way, like I'm going to show you later. Just discuss how the researchers decide which statistical method to use to analyze the results. And then we talked a little bit about the hazard ratio. You can discuss the difference between that and the relative risk, and the other method they use to present the data in different study types. And then we talked also about the Wilcox rank sum test, and I actually brought to them a very nice table that I found in the online research methodology lecture by Stanford, and to kind of just talk to them a little bit about which statistical method usually researchers use, to analyze the data. And we discussed the three things that basically we look at to determine that. So we look at the type of the outcome variable. Is it continuous variable? Is it binary variable? Is it time to event? It was time to event in the article that we discussed. And then we talked about whether the observations are related or correlated or independent, and then the basic assumptions for many of these statistical tests. So again, make it simple, make it brief, but at least bring the basics of this to the audience. They will really like it, and then that will really make that journal club presentation most useful. And as you do more and more journal club, and people emphasize these points more and more, and they bring it up to discussion more and more, and the audience will be more familiar, the resident will be more familiar with it, and then it will be more easier to understand. And then in the future, as you read the paper, it will be really second nature, hopefully. When you read it, you can understand it a little bit easier. So, all right, and then that's the end of this section, and then we'll talk about the next one in the next video.